Sexual myths and misconceptions are often perpetuated by society and can lead to confusion, shame, and misinformation. In this video, we'll explore some common sexual myths and misconceptions and provide accurate information to help dispel these misconceptions. Myth: men think about sex more than women. Reality: both men and women think about sex, but studies show that men tend to think about sex more frequently than women. However, this does not mean that women are less interested in sex than men. Women may express their sexual desires differently or may be socialized to suppress their sexuality. Myth: a woman can't get pregnant during her period. Reality: this is a common misconception, but it is possible for a woman to get pregnant during her period. Sperm can live inside the female body for up to 5 days, so if a woman ovulates shortly after her period ends, she could still get pregnant. Myth: the size of a man's penis determines his sexual prowess. Reality: penis size has no correlation with sexual ability or pleasure. Sexual satisfaction is determined by many factors, including communication, emotional connection, and technique. It's important to remember that every person's body is different, and there is no one right size for a penis. Myth: women can't have an orgasm. Reality: women can and do have orgasms. However, some women may have difficulty achieving orgasm due to various factors, including anxiety, lack of communication with their partner, or medical conditions. It's important to prioritize mutual pleasure and open communication with your partner to enhance the sexual experience for both parties. Myth: masturbation is unhealthy or immoral. Reality: masturbation is a natural and healthy activity for both men and women. It can help reduce stress, improve sleep, and enhance sexual pleasure. There is no shame in exploring your own body and discovering what feels good to you. Myth: sex should always be spontaneous and passionate. Reality: while spontaneous and passionate sex can be enjoyable, it's not the only way to have a satisfying sexual experience. Communication, experimentation, and planning can also lead to fulfilling sexual encounters. It's important to prioritize consent, mutual pleasure, and open communication to ensure a positive sexual experience for all parties involved. Myth: anal sex is only for gay men. Reality: anal sex can be enjoyable for people of all genders and sexual orientations. However, it's important to communicate with your partner and take proper precautions to prevent injury and STI transmission. Anal sex requires communication, relaxation, and the use of appropriate lubrication to ensure a safe and enjoyable experience. Myth: oral sex is safe sex. Reality: oral sex can transmit STIs, including HIV, herpes, and gonorrhea. It's important to use condoms or dental dams to reduce the risk of infection. It's also important to prioritize communication with your partner about sexual health and to get tested regularly for STIs. In conclusion, sexual myths and misconceptions can be harmful and perpetuate shame and stigma around sexuality. By educating ourselves and challenging these misconceptions, we can create a more informed and sex-positive society. Remember to prioritize consent, communication, and mutual pleasure in all sexual encounters, and to prioritize your own sexual health and well-being.